Focused and fearless. Here's everything you need to know. This rush hour of March 12, Thursday, I am Royce Nagy. We open today's rush with the country's second fatality due to COVID-19. The Department of Health said the casualty is patient number 35, who was then confined at the Manila Doctors Hospital. She's a 67-year-old Filipina who only tested positive yesterday, just hours before she died. The DOH says they are still gathering and validating reports about the patient's death and will provide information as soon as possible. Recall that a Chinese national who had a travel history to Wuhan was the country's first COVID-19 casualty. In the meantime, the public is advised to share only verified information about the virus outbreak. Including patient 35, 16 more people have tested positive for COVID-19 in the Philippines. Here's what we know about them. The 16 additional cases are all Filipinos, which bring the total count of Filipinos who contracted the virus at 44. Only 3 of the new cases have records of exposure with a COVID-19 positive patient. 2 of them are still for verification, while the rest had no recent travel history to any COVID-19 affected country, nor did they make contact with any infected person. This means that 20 people have contracted the virus through localized transmission. Most of the new cases are confined in different hospitals in the metro. This now includes the Philippine Heart Center in Quezon City, the Asian Hospital in Muntinlupa, Manila Doctors Hospital, and Las Piñas General Hospital. That's on top of facilities outside Metro Manila, including J.B. Lingad Hospital in San Fernando, Pampanga, Ace Dumaguete Doctors, and Northern Mindanao Medical Center in Cagayan de Oro. Most of the patients lived in Marikina, San Juan, and Makati, while the rest are from Taguig, Rizal, Pasig, Quezon City, Manila, Cavite, San Jose del Monte in Bulacan, Negros Oriental, and Camarines Sur. The agency is still verifying the address of 16 patients, while 4 of them do not have any residence in the Philippines. As COVID-19 cases rise in less than a week, according to Health Secretary Francisco Duque, the challenge now is to prevent the situation from reaching an epidemic peak. But he admits more could have been done sooner. Here's the report.
Speaking before lawmakers, Health Secretary Francisco Duque III admitted that he could have declared a state of public health emergency early on.
Being a member country of the WHO, ipinaubaya po namin yung kanilang pag-declare ng public health emergency of international concern. Yun lang po. It's a de facto declaration on my part.
Sa tingin ko mahalaga na prior to the declaration of the President, no? Dahil kayo ho ang sa pangunahing may poder nito, ay nagdeklara kayo para ang lahat na agencies ay ma-forward na, no? Makapaghanda na, no? Dahil ho ang tingin ko parang pardon my term, nagkampante tayo.
Yes, I will concede to that.
The country is currently under Code Red Alert Sub-Level 1 after the DOH confirmed the first case of localized transmission. But as per Duque, the Philippines is still far from what is called an epidemic peak, where cases number by the thousands. But this is no reason to be complacent.
We still have resource limitations like most other countries. And from number of available isolation rooms to ICU during epidemics,
Duque said the objective now is to delay the epidemic peak, which could be effectively achieved through social distancing. But Duque admitted that this will be a challenge.
pagtugon naman sa mga atin mas mahihirap na mga kababayan, yung mga informal settlers, yung mga sumasakay po sa mga mass public transport, talagang napakamalaking hamon po ito.
During the Senate hearing, the Secretary also said that 3 more foreigners caught the disease after visiting the Philippines, including a Japanese national who spent 7 to 9 days in the country, a Singaporean who stayed for 3 days, and the South Korean who spent 2 months here.
Meanwhile, more Pinoys abroad have tested positive for COVID-19. According to the Philippine Embassy in Singapore, of the 166 patients infected with the virus in the city-state, 3 are Filipinos. 1 of them already recovered, while 2 remain at the hospital for treatment. In Hong Kong, another Filipino tested positive for the disease, bringing the total number of infected Pinoys there to 5. The Philippine consulate in Hong Kong says 1 had already been discharged, while 4 other Filipinos are currently in quarantine after being contact traced to COVID-19 positive patients. Because of these developments, the global tally of the coronavirus disease is now over 125,000. 4,594 of them have died, while more than 66,000 people have already recovered. And for the first time, the World Health Organization has described the coronavirus situation as a pandemic. Director General Tedros Ghebreyesus urged the global community to redouble efforts to contain the spread of the virus, saying aggressive measures could still curb the pandemic. He clarified that the pandemic characterization did not change what the WHO was doing or what countries needed to do.
Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never been before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time.
Trying to be a step ahead, some government officials have placed themselves under self-quarantine. Philippine Star reports that Finance Secretary Sonny Dominguez, Senators Win Gatchalian and Nancy Binay, as well as Manila Mayor Isko Moreno, said they would go on self-quarantine after possible exposure to infected persons. The 2 senators were in a hearing last week with a resource person that later was confirmed positive. Dominguez says he met with a fellow that also tested positive, while Mayor Isko just got back from the United Kingdom after a meeting with their COVID-19 task force. Amid the virus outbreak, Palace reminds the public not to start panic buying. According to Pangmasa, Palace urged the public to buy only what you need. Panic buying, Malacanang says, would only result to hoarding and price increases. On the other hand, the DTI assured adequate supplies of essential items. And this from Filipino Star ngayon, the rapid test kits developed by the UP National Institute of Health will take only up to 2 hours to detect a COVID-19 positive patient. That's a significant improvement from Japan's testing kits, which takes a day before confirmation. The local kits are also cheaper at just 1,500 pesos each compared to imported products that cost up to 30,000 pesos. However, supply are limited with only 2,000 units as of this time. Though the university has pledged to produce up to 2,000 kits per week once it gets the green light from health authorities. The health department says hospitals are not turning down suspected cases of COVID-19. However, some hospitals refer PUIs to other facilities due to their limited capacity. Patricia Mangune with the story.
Earlier on Wednesday, an internal memorandum from the medical city in Pasig circulated on social media. It said that due to manpower limitations, the hospital will temporarily stop admitting patients under investigation for COVID-19. Pasig City Mayor Vico Soto clarified this does not mean the patients will be rejected, but will instead be referred to other hospitals. But the medical city in a later statement clarified the matter. An internal memo to temporarily control the inflow of new COVID-19 patients was maliciously leaked to the public. TMC now handles 8 cases of COVID-19 and 31 PUIs, which exceeded their daily load of patients. While this has taken a toll on their resources and personnel, the hospital said It will continue to attend to all patients as long as their capacity allows it. The health department meanwhile said hospitals are not turning down PUIs, but that those with mild symptoms are allowed to go home pending test results. According to the DOH, levels 2 and 3 hospitals can accept PUIs.
Ang mga ospital po natin ay tumanggap po ng mga patient under investigation na may mild symptoms.
The Private Hospitals Association of the Philippines claimed that they are prepared, but end up referring cases to other hospitals due to limited capabilities in handling infectious diseases. This is to avoid mishandling and the further spread of the contagious disease.
Prepared in a sense that we have one infectious room in every hospital because you cannot be given the license to operate unless you have one.
Aside from this, private hospitals do not own COVID-19 test kits at the moment, with bulk of the supply going to state hospitals under the health department.
We will still see it after 1 or 2 days. We send the specimen to RITM kung available. Kaya the fact hindi naman nagbibigay ng WHO sa amin eh. It's always through DOH kasi yun natang protocol nila.
As a temporary preventive measure, some private hospitals set up a triage tent to filter patients or visitors while checking their temperature and provide hand disinfectants. For News 5, Patricia Mangunin, we are One News.
Google is working behind the scenes to block misinformation about the coronavirus. Let's watch this. Let's now fast break to Sports Rush. The PBA Board of Governors has called off its ongoing games due to COVID-19. These include the PBA Philippine Cup, the PBA D-League Aspirants Cup games, and the scheduled PBA 3x3 inaugurals. But Commissioner Willie Marshall says that teams can still continue with practice. League officials promised to reassess the effects of the coronavirus on a day-to-day basis to determine if it's safe to hold games again. Right now, the league's priority is ensuring the safety of the fans, players, teams, and staff.
Ang iniintindi muna namin yung kalagayan nating lahat. Hindi na namin tinitingnan kung ano mawawala sa amin, anong maano namin. Ang mahalaga yung safety ng lahat. Sa inyo, ako, at yung mga fans natin.
And that's how the day is shaping up to be. Join us again next time for another round of Rush. For Riza Diaz, I am Royce Snagit. We are One News.